my name's Colette. I'm a community mental health nurse for the Aberdeen Alcohol and Drugs Partnership. We want to outline some important information for people that have been referred or are considering opiate replacement therapy. People are referred to our service if they've become dependent on opiates and are looking at opiate replacement therapy as an option to treat their dependence. Some people continue to take opioids long term or when they aren't prescribed them. This can be for various reasons, but in these circumstances, this can pose some significant risks, particularly the longer you use them, as you'll need to use a higher dose to get the same effect. This is what we call tolerance. Opioids are also very addictive. Once you are taking them regularly, your body becomes dependent on them, which means that if you suddenly stop taking opioids, you can experience some unpleasant withdrawal effects. These include both physical symptoms, such as tremors, aches, pain, diarrhea and sweating, or psychological symptoms such as anxiety and agitation. Opiate medication is prescribed for people that have got opiate dependence. The goal of this is to manage withdrawal symptoms effectively, but also to help cravings for opiates. Accessing treatment for opiate dependence is not just about medication, it's also about looking at all aspects of your life and what things impact on your use of substances. These can include things like your physical health, your mental health, and social factors such as housing, benefits, debt management. Also looking at your social activities and how you feel your day and seeing if there's things that we can support you in, such as further education or accessing social or support groups. The two main medications that can be prescribed as opiate replacement therapy are methadone and buprenorphine, and there are some key differences between these, which we will now look at in more detail. We have lots of information and advice available within our service. Also, all of our workers will be able to provide you with detailed information and will support you to make a safe choice that suits your circumstances best. Methadone is a liquid taken once a day, ideally at the same time each day. It can come with or without sugar, but usually tastes quite sweet. If you take a drink of water immediately afterwards, it'll help make sure you look after your teeth. Methadone can be quite sedating and can make you feel a bit sleepier than other opiate replacement therapies. It also has a small risk of overdose as it slows down your breathing, just like other opioids. This risk is more likely if your initial dose is increased too quickly or if you're taking other medications or using other substances that also make you drowsy. This includes alcohol. To reduce these risks, the dose of methadone will usually start quite low and gradually increase until your withdrawal symptoms and cravings stop. Because the dose needs to be increased slowly, it can take a few weeks to find the level that's right for you. People taking methadone should feel comfortable but not over-sedated. The final dose requirement will be different for everyone and will change over time, so it's best not to start with a fixed idea or targets in your head. We will work with you to start methadone and reduce your risk of harm from other medications or substances you take. This means we will need to ask you about other drugs you are taking. The more information you give us, the easier it is for us to help you reach your goals. The other medication we offer as opiate replacement therapy is buprenorphine. Buprenorphine works in a slightly different way to other opioids. Effectively stops symptoms of withdrawal and craving without making you feel as sedated or sleepy. This can be helpful to support you if you need to get back to roles such as work or driving or operating heavy machinery. You are likely to feel like you have a clearer head with buprenorphine than with methadone, which may suit some people more than others. As buprenorphine sticks to the receptors in the brain more tightly than other opioids, it can stop other opioid medication from having an effect. This means that if you take or are prescribed other opioids on top of being prescribed buprenorphine, you may get a reduced effect from them. This also means that if you still have opioids in your system when you take your first dose of buprenorphine, you might get some withdrawal symptoms. To help minimize this, we'll ask you to stop taking other opioids and start the buprenorphine once you start experiencing withdrawal symptoms. Buprenorphine also has fewer interactions with other medications and has less effect on the other diseases people may have, including heart or breathing problems. This can make buprenorphine better suited to patients with other health conditions. The side effects of buprenorphine can include weight change, headaches, disturbed sleep, and sweating. We will support you to minimize or manage any side effects you experience when you first take in buprenorphine. When you first start taking buprenorphine, we will split your initial dose on day 1 so that if you have other opiates in your system, you're at less risk of experiencing withdrawals. This first dose will be supervised in the pharmacy to make sure you're happy with how you take the product. The second dose will be given to you and taken at home later in the day. Buprenorphine comes in 3 main forms, meaning that you have a choice on how you take these. There are tablets which are dissolved under the tongue. They come either as buprenorphine alone or combined with naloxone. The naloxone included in the tablet has no effect if they're taken correctly. However, if they are taken in any other way, the naloxone can have an effect and will give you symptoms of withdrawal. Brand names you may recognize are Suboxone and Subutex. These are placed under the tongue and dissolve over about 10 minutes. If you have a dry mouth, a drink of water can help. There is also a wafer form of buprenorphine called Espranor. This is placed on your tongue and dissolves faster than those that are under the tongue. There is also a long-acting injectable called Buvidal, which we can give you either once a week or once a month, and goes in your arms, stomach or thigh. It means you don't have to go to the pharmacy for your medication every day. So when you first start taking opiate replacement therapy, you'll be seen by the pharmacist every day. You pick a pharmacy that's closest to you when you first start off, so hopefully then you'll be able to get in and can access support from the pharmacist every day. They'll be able to assist you in the first instance. Any other concerns you have, you can contact someone here at the service. We'll happily discuss your dose or any adjustments that's needed, or also talk to you about any side effects you might be getting from the medication and make any changes that will be better for you. People maybe will have different times along their recovery, so people tend to need a bit more support kind of starting off or establishing on ORT, but then at times of crisis or other times in their life they maybe need a little bit more support. I guess it's not linear, which doesn't help. It's just when people are needing a bit more support, we'll maybe be a bit more involved. If you're struggling to get in, we can also provide some telephone support for you. I'll happily discuss things. There's always someone on duty here, so any one of the nurses or clinicians can talk to you if there's anything you're concerned about when you first start taking your treatment. As it's a controlled medication, there's certain kind of rules on who can dispense it. A pharmacist needs to be kind of in pairs with a pharmacist and their assistant, so sometimes it can take a little bit of a while getting you set up in the pharmacy. They can only dispense it on a prescription and it has to be dispensed how we've outlined it. So if you need to take medication away or if you're unwell and can't collect it, we need to make changes to that. But it's easily done if you get in touch with us here. If the pharmacy is closed, they'll dispense your dose away the day before and give you clear instructions on how and when to take it. If they're closed for a couple of days, they'll dispense a couple of days medication away to you. Part of your assessment will look at who else is in the house with you and how to safely store any medications you might take away. We've got secure boxes here that we can provide you with to make sure that no children or other adults are able to get in. They're secured with a lock and key, and we'd always discuss with you how best or safely to store your medication. If you're on buprenorphine, Buvidal injections, they can come either as a weekly injection, which you'd attend the clinic for, or a monthly injection. Most of the injections are currently here at the clinic or at the Fulton Clinic. Some pharmacies are starting to do injections. So once you're established and stable on your dose, we will support you to access pharmacy to get your medication, to get your injection. There is always a small risk of overdose, even on opiate replacement therapy. That risk increases if you're using other substances that also depress your central nervous system, that relax your breathing and can slow your breathing down. Everyone that accesses our service will be offered naloxone. It comes as both a Nixoid spray or the prenoxide injection. We'll discuss with you how to notice the signs of an overdose, how to administer naloxone or the Nixoid sprays. Nixoid and naloxone can be used to reverse the symptoms of that and can help buy a bit of time for emergency services to get in to respond. We offer naloxone to everyone that attends the service, including family and friends of anyone that's on opiate replacement therapy or using other substances. We're also trying to increase naloxone use to members of the public and increase awareness. The amount of time you're on opiate replacement therapy really depends on you. There's some people that feel settled on it and will remain on opiate replacement therapy for extended period of time. There's others that want to kind of stabilise and then reduce their opiate replacement therapy. It really is whatever suits you best. All of us here as a service understand the anxiety and trepidation for accessing treatment and support. We want to encourage you to come in and speak to us. We will find something that suits you best and discuss your options in terms of opiate replacement to find out what is going to suit you best, suit your lifestyle, suit your substance use. We're not here to judge your life. We just want to make it safer for you to use and get treatment.